Hello everyone, welcome back to my channel. As many of you have requested to do sessions on important questions since exams are nearing, I am now with the important questions from the region Abdomen and Pelvis. So when I did the last session, some of you have asked me, is there any need to write if the diagram is self-explanatory? The thing is, for theory exams, it is a descriptive exam. So the one in front of you actually decides your marks, because if someone has written elaborately with more and more points along with the diagram, of course we have to give more marks to that person. So if when your paper comes next, even if you have drawn everything with all write-up in the diagram, if you are not trying to write something about it as a body of the question, I mean the answer, then definitely you will score less. So what I prefer to say is, for short notes, you have to write as well as you have to draw the diagram, even if the diagram is self-explanatory. But in case of diagrams alone, like draw and label one diagram, then in that case you have to draw only the diagram with all the labeling part. Okay, so that point you have to keep in mind. I'll be doing a session on how to write an exam and what are the things which we evaluators expect from you in a session, so that you can score more marks. I'll be doing it. Due to time constraints, I'm not able to do all these things in one go, but I'm trying my level best to help you all. So in this session, we will be dealing with the important topics from abdomen and pelvis. One more thing, even if I say these are the important topics, all of you should read the entire thing at least 2 or 3 times before the exam. And this is just for revision sake, because for revision, if you sit for the entire topic, then it will take more and more time and you won't be able to complete the topic. That is the reason why I am stressing on important topics like this. But I prefer you all to have an idea of every topic, and you have to read the entire topic, say at least 2 or 3 times before you appear for the exam. And this is just for revision purpose, so that in the revision days, say 2 or 3 days before the exam, you have to stress on these important topics. That is my view. Okay. So let's start. Again, the book which I am referring is again textbook of anatomy, abdomen and lower limb, volume 2 by Vishram Singh sir. Whichever book you prefer, you can follow that, but personally speaking, I've been following this book along with Datta, anatomy by Datta. But for undergraduate level, anatomy by Datta, it will be a bit hard to crack, and the diagrams are actually well explained in this book. The book by Vishram Singh sir. Okay, so we will start with chapter 2. It is mainly osteology session, but again, though osteology is asked for practical exams, for theory exams, since you are going to get a question paper of 100 marks according to the revised curriculum, you can expect questions from osteology as well. So you have to know some important points from osteology. Then again, abdomen as such is a very favorite part for practical purpose. So when you study for practical purpose, you need to know the entire thing from abdomen and pelvis, but for theory purpose, again, you can be a bit selective. So from chapter 2, you can go for the clinical correlation, which is given under lumbar vertebra. Okay, in that case, you can read about spondylosis and spondylolisthesis. You should know the difference between the two, and something about cauda equina syndrome. You can expect a short note on intervertebral disc as well. Coming to sacrum, you should be knowing about the sacral canal and its contents, and the clinical correlation, like what do you mean by sacralization, what do you mean by lumbarization. Sometimes you might get one mark questions like define lumbarization, sacralization, like that. Then there is a tabular column where the differences between male and female sacrum is enumerated. You can just have a look at the tabular column. Then likewise, when you come to the bony pelvis, the 6 differences of the bony pelvis, both male and female. So the benefit of the tabular column is that you just have a look at this tabular column. It is a very small table and you will feel like reading it. But at the end of reading, you will get to know that you know many points when you are asked to write a short note on that. Okay, so that is the importance of the tabular column. So always stick to tabular columns and it will really save time as well. Now we are moving on to the anterior abdominal wall, the next chapter. In that chapter, definitely you should be knowing about the abdominal planes, the different abdominal planes. Sometimes you might get a short note like, what do you mean by transpyloric plane alone? Like that you can expect a short note as well. Then coming to the anterior abdominal wall, you should be knowing the layers of the anterior abdominal wall. Then coming to the clinical correlation of that, short notes expected are exomphalus or omphaloceal and congenital umbilical hernia. Then coming to the superficial fascia, you know, there are fascia like campus fascia, scarpa's fascia. So scarpa's fascia alone can be asked as a short note, and the clinical correlation, sometimes it can be asked as a part of the structured essay, like when you get a rupture in the urethra, what is the relation of these fascia and how you get the urine collected. That part is given under clinical correlation. That concept you have to be clear. Then you should be knowing about the superficial veins of the anterior abdominal wall. Then the clinical significance of these veins of the anterior abdominal wall, like what will happen in case of portal venous obstruction. We know about caput medusa, isn't it? And what will happen in caval obstruction. So these two diagrams will give you a clear idea about what is happening in these situations. That part you should be thorough. Then coming to the muscles of the anterior abdominal wall, you should be knowing what are the main muscles. Don't skip the entire thing when I say these topics are important. You should have an idea, like muscles of the anterior abdominal wall, you should be knowing which are the abdominal muscles. And in particular, you should be knowing in detail like external oblique muscle, internal oblique muscle, what are the modifications seen in that. You have to know in detail. Then the structures derived from the flat muscles like the inguinal ligament, conjoint tendon, cremaster muscle. All the three are favorite short notes. Then coming to the rectus abdominal muscle, the muscle alone can be asked as a short note. Then the rectus sheath. Rectus sheath is a very favorite question. The contents of the rectus sheath or the formation of the rectus sheath. Both are very important. Then clinical correlation like a divarication of recti, epigastric hernia, those two topics are also very important. Now coming to the fascia transversalis, you should know the important features of fascia transversalis like deep inguinal ring, the formation of internal spermatic fascia, all those derivatives you should be knowing the important features of fascia transversalis. Then the clinical correlation like the abdominal incisions, there's a very beautiful diagram given here. If you just have a look at this, it will be easy for you the day before exam. If you just focus on that diagram, it will be easy for you to have a quick recap. Then coming to the inguinal region, inguinal ligament, again very important. In the inguinal ligament, you should be knowing about the expansions of the inguinal ligament. Then about the subinguinal space, then the femoral sheath. Femoral sheath actually we will be studying in detail when we study the lower limb. Then femoral canal, all those comes in the lower limb as well. Femoral hernia. Femoral hernia, the coverings of femoral hernia, all these can be asked as an essay question as well. Then coming to the inguinal canal, you should know the extent of the inguinal canal, because inguinal canal, the hernia, the direct and the indirect inguinal hernias, all these can be asked as structured essay. So in the structured essay, you will get sub questions like what is the extent of the inguinal canal, then the inguinal rings, deep and superficial inguinal ring, you can get a short note. Then the structures, this tabular column, you can get the structures passing through the deep and superficial inguinal rings. So if you just focus on this table, even the day before exam, you are not able to read the entire thing. Just table alone will help you remember many things. Then coming to the next topic, spermatic cord, you should be knowing the coverings and contents of the spermatic cord with the help of a diagram. Then sometimes you will get, you will be asked to write a short note on mechanisms to maintain the integrity of the inguinal canal, like the different mechanisms, the flap valve mechanism, the shutter mechanism, slit valve mechanism. So if it is, if you're finding it tough, just focus on 2 or 3 mechanisms, then it will be easy for you. Then Hasselbalch's triangle or inguinal triangle, the boundaries and contents you should know. And the inguinal hernia, both direct and indirect inguinal hernia. That will be if you just focus on these 2 tabular columns. In the first column, how you will differentiate the inguinal hernia from the femoral hernia, and the other one, differences between indirect and direct inguinal hernia. If you just focus on these 2 tabular columns, then it will be easy for you, and you will be able to write a short note on both direct and indirect inguinal hernia when asked. Okay, you need not mug up the entire theory part the day before exam. You just focus on the tabular columns. Now coming to the male external genital organs, there you have to focus on the scrotum, the layers of scrotum, very very important. Then coming to the next thing, the testis. All these topics you will be studying in detail for practical exam, but for theory purpose you should be knowing the coverings of testis, the parts of testis, with the help of diagram. Okay, so if you draw this diagram, then how about it will be clear about the interior of testis as well, and if you draw this diagram you will be knowing the important relations of testis as well. And the clinical correlate expected from here is hydrocele. You should be knowing what do you mean by hydrocele. I'm not discussing about the histology, the microscopy of all these structures. We'll be doing it under histology. That doesn't mean that you should not be knowing, because gross anatomy it comes along with histology. Systemic histology will be asked along with the different systems. Now coming to the arterial supply and venous drainage, the paminiform plexus of veins alone can be asked as a short note. Then along with that you can get a question like, what do you mean by varicocele? So the arterial supply and venous drainage of testis is again very important. Then torsion of testis, sometimes it can be asked as a structured essay. Then coming to epididymis, you just know what are the different parts of epididymis. Then development of testis and epididymis, the derivatives of the ducts, the genital ducts, very very important. So when you study embryology, the systemic embryology, you keep all these points in your mind. Then the descent of testis, so all these topics are favorite questions. Then the clinical correlate from this topic is cryptorchidism and ectopic testis. What do you mean by cryptorchidism and what do you mean by ectopic testis? In 1 or 2 sentences, you just have an idea. Then coming to the abdominal cavity, you can see this tabular column where the 9 regions of the abdomen and their contents are mentioned. You just focus on that table so that the entire thing will be clear for you the day before exam. Now coming to the peritoneal folds, you should know how to classify the peritoneal fold, like mesentery, the omenta, the ligaments. Okay, so if you just know the classification, then you can elaborate on it. Then the derivatives of the developing gut in the abdomen, again it is given as a tabular column. Then you can expect short notes on greater omentum, lesser omentum and mesentery. Greater omentum, lesser omentum and mesentery, they are all favorite short note questions. Then again falciform ligament. Then coming to the peritoneal cavity, the first thing you should be knowing is subdivisions of the peritoneal cavity into broadly divided into, you know that, the greater sac and the lesser sac. Now when you come to the tracings of the peritoneum, the greater sac you should be knowing because it is a favorite question. Coming to the intraperitoneal foci, the lesser sac is very important. Then subphrenic spaces alone can be asked, where you will get the lesser sac, the hepatorenal pouch, all those things comes under the subphrenic space. So first thing you have to do is, what do you mean by subphrenic space and how are they named? You know there are 6 subphrenic spaces, and in those 6 spaces you need to know in detail about the hepatorenal pouch of Morrison, because that alone can be asked as a short note, and lesser sac, that again can be asked as a short note. Then foramen of Winslow, epiploic foramen, the boundaries, very very important. Then coming to the recto-uterine pouch or pouch of Douglas, that also can be asked as a short note, because there is the clinical significance of that. You should be thorough with that point. Then coming to the esophagus, stomach and spleen. In the esophagus, esophageal varices, achalasia cardia. Those are two favorite questions. Then coming to the stomach, you need to know about the location of stomach. Then there is a tabular column given which enumerates differences between the cardiac orifice and the pyloric orifice. So if you just focus on that table, then you can write a short note on stomach as well, the cardiac orifice, the pyloric orifice, the different parts of the stomach. The different parts of the stomach you just study with the help of a diagram, so that the day before exam you just need to focus on that diagram alone. Then coming to the relation, you need to know about the stomach bed, the structures forming the stomach bed. There is a very beautiful mnemonic given here, Dr. S3 kills patients mercilessly. You can just go through that so that it will be easy for you. You just imagine stomach, the stomach bed and this code, then it's done with the help of one diagram. Then coming to the interior of stomach, what are the things making up the interior of stomach, you just know that. Then very important part of stomach is the arterial supply, the venous drainage and lymphatics, because if you know these three important topics, then it will be easy for you to solve the structured essays, because structured essays definitely you will get these as sub questions. Because sometimes the structured essay, the patient might be having gastric carcinoma, then associated conditions, or gastric ulcer, then the sub questions will be what is the blood supply, what is the lymphatic drainage, like that. Then coming to the nerve supply of stomach, there are sympathetic and parasympathetic nerves supplying the stomach. There is a beautiful diagram given here showing the parasympathetic nerve supply, and along with that you need to know what do you mean by vagotomy. That again you need to know. Then coming to spleen, you should be knowing the surfaces, especially the visceral surfaces and the structures related. That's very important. Then coming to the blood supply, we need to know the segments of the spleen. Okay, according to its blood supply you need to know that. Then what do you mean by splenectomy? These headings you give more stress when you read. Then coming to the liver and extrahepatic biliary apparatus, there is a tabular column showing the notable features on the diaphragmatic and visceral surface of the liver. If you just have a look at that, it will give you an entire view of the liver. Then the lobes of liver, the anatomical lobe and the physiological lobe, again two beautiful diagrams are given how to differentiate between anatomical and physiological lobes. If you study with the help of that diagram, again just flipping that diagram will help you to cover the entire topic. And the segment, the Cunard segments, the hepatic segments, again with the help of diagram you just focus on that, so that the day before exam you just have a look at these three diagrams, then it's done. Then the ligaments of liver, we know that there are two types, false ligaments and true ligaments. In the false ligament you can expect a bit in detail, like short notes on falciform ligament, lesser omentum, like that you can get a short note. Then the relations of the diaphragmatic and visceral surface, again a tabular column is given. You just focus on that tabular column alone rather than going on in the detailed reading. Okay. Then one important thing I would like to mention is the day before exam you will feel like you have to read the entire thing, but forget about it. You just focus on the tabular columns and images, and you flip the pages so that you will begin from the beginning and you will be ending till the last page, so that you won't be going for the exam without seeing any one single topic. Okay, so don't, you definitely will have a feel like you need to read the entire content, but don't worry, every one of us will be having the same feel, but just focus on the tables and the figures. That will be easy for you to remember the entire thing which you have read previously. Then read about porta hepatis. Then surgical importance of the bare area of liver, needle biopsy of the liver. Those things can be asked as a short note. Then microscopy I am not mentioning here. Then the extrahepatic biliary apparatus, what are the components? Then coming to gallbladder, what are the parts of gallbladder? Then arterial supply of gallbladder, again asked once. Then short note on cystic duct, common bile duct. These two things, the parts of the common bile duct you should be knowing. Then something about sphincter of Oddi, the different parts of sphincter of Oddi you should be knowing. Then sometimes Calot's triangle, the cystohepatic triangle, the importance of that. Then in the clinical correlation, you should be knowing about cholecystitis, the type of pain you get in cholecystitis, because in structured essay you will have to know in order to identify the condition. Then about Courvoisier's law. Then coming to the imaging of biliary tract, cholecystography, and what do you mean by ERCP? Sometimes ERCP alone can be asked, so you should be knowing the expansion, endoscopic retrograde cholangiopancreatography. Coming to the duodenum, pancreas and portal vein, the next chapter. In the duodenum, the second part of duodenum is a very favorite question. So the relations of the second part and the interior. Then suspensory muscle of the duodenum, the ligament of Treves alone can be asked, and duodenal recesses. Then clinical correlate of this is duodenal ulcer. Coming to the pancreas, you should be knowing the parts of pancreas definitely. Then with the help of diagram, like the relations of the head of pancreas, relations of the neck of pancreas, just focus on the diagram. You need not read the entire thing. Just with the help of diagrams, you just see which are the important structures related. Then the important part of this is duct of pancreas, can be asked as a short note. Then the development along with embryology, you have to cover it. Then arterial supply, you just know which are the main branches. No need to know the detail, but just know the name of the branches. Then the carcinoma of head of pancreas and acute pancreatitis. Just know what is the clinical condition so that you can solve the structured essay. Coming to portal vein, you should be knowing the tributaries of portal vein and the anastomosis, which are the sites of anastomosis. And there is a tabular column depicting the sites of anastomosis and the clinical signs. That tabular column alone will help you to solve many questions. And the clinical correlation is portal hypertension. Coming to small intestine and large intestine, you should be knowing about Peyer's patches, the mesentery of small intestine. Then there is a tabular column differentiating the jejunum and ileum. If you just focus on that tabular column, any question from that small intestine part you can solve. Then the Meckel's diverticulum, again a favorite question. Coming to the large intestine, the difference between small intestine and large intestine, where a tabular column is given, please go through that. Then types of cecum, it is very important. Then the interior of cecum, the ileocecal orifice, is again very important. Then coming to the vermiform appendix, you should be knowing the different positions of the vermiform appendix. Then appendicitis, McBurney's point, that also you have to keep in mind. Then coming to the arterial supply of colon, you just have a look at this diagram. That will help you to remember the arterial supply of large intestine, the colon. Then the marginal artery of Drummond can be asked as a short note. Then read about congenital megacolon or Hirschsprung disease. Coming to the vessels, superior mesenteric artery and its branches. Very important, and inferior mesenteric artery and its branches. If it is difficult for you to know the theory part, just focus on the important branches and just a diagram. That will be enough. Then coming to the kidney, you should be knowing the location of kidney and mainly the anterior and posterior relation with the help of a diagram. Then the capsule of kidney, especially the renal fascia or fascia of Jorota, you should be knowing. Then about renal arteries, very important, how they branch and rebranch. Then the vascular segments, again very important. Kidney as such is very important. The vascular segments with the help of diagram you can study. Then common congenital anomalies expected from kidney. Then floating kidney, and what do you mean by transplantation of kidney? All these are favorite questions. Surface marking of kidney, you know how to draw the Morse parallelogram. Then in that chapter, thoracolumbar fascia was once asked as a short note. Coming to the ureter, you should be knowing the constrictions of ureter. Then coming to the adrenal glands, there is a tabular column showing the relations of the suprarenal glands, both right and left. You just focus on that tabular column. Then Addison's disease, Cushing's syndrome, adrenalectomy, pheochromocytoma. All these just know in one sentence what do you mean by all those things. Now coming to the next chapter, the posterior abdominal wall, you should be knowing about what do you mean by psoas abscess, how this abscess is tracking. Then about abdominal aorta and its branches. Again there is a schematic representation. That's just a flow chart. This flow chart is enough for you the day before exam to just have a photographic memory. Then the inferior vena cava and its tributaries, very important. Then coming to the nerves, lumbar plexus you should be knowing. Then celiac plexus you should be knowing. Then the superior hypogastric plexus along with the inferior hypogastric, which is mentioned in another chapter. Then what do you mean by lumbar sympathectomy? That should be knowing. Coming to the pelvis, you should be knowing about symphysis pubis, sacroiliac joint. Then what do you mean by true pelvis or obstetric pelvis and the diameters of obstetric pelvis? Just know what are the diameters and just the measurements. And the types of female pelvis, the 4 types of female pelvis you should be knowing. Coming to the pelvic wall, the next chapter, levator ani, very important, pelvic diaphragm, pelvic fascia, all these are very important. Then the nerves of the pelvis, the lumbosacral trunk and sacral plexus you should be knowing in detail, and in that chapter you will come across the inferior hypogastric plexus. So all these things you just focus on the different branches the day before exam. Don't read the entire content, just make sure you have just gone through the main branches at least. In that chapter again, the internal iliac artery, very favorite question, and its branches, you focus on that. Then coming to the perineum, there you have the superficial and deep perineal pouches. Superficial and deep perineal pouches, there are 2 tabular columns. One is structures within the deep perineal pouch, then one is structures within the superficial perineal pouch. You just focus on those tables with the help of 2 diagrams, that's enough. Then urogenital diaphragm, the structures piercing the perineal membrane, because perineal membrane was once asked, and perineal body, again very important. What will happen when there is damage to perineal body? Then you have to know that. Then coming to the next topic, ischiorectal fossa. It can be asked as a structured essay as well. In the ischiorectal fossa, the boundaries of the ischiorectal fossa with the help of the single diagram, that is enough. So the day before exam you just focus on that diagram, that's enough. And ischiorectal abscess. Then some other favorite short notes from this region is, what do you mean by perianal space, what do you mean by pudendal canal or Alcock's canal, what do you mean by pudendal nerve. So when you read pudendal nerve, just remember the main branches of pudendal nerve, that's enough. And how will you give a pudendal nerve block, that's enough. Then coming to the next chapter, urinary bladder. In the urinary bladder, size, shape and all are practical exam favorite questions. The relations of the base of bladder, there is a diagram given here, you just focus on that diagram, then it will be easy for you. Then the relations of the urinary bladder, tabular column is given, just focus on that tabular column. Then coming to the ligaments of the bladder, again there are true ligaments as well as false ligaments. A beautiful diagram is given there, you just focus on that diagram to study that topic. Then coming to the interior of bladder, trigone of bladder, both external trigone and internal trigone, you have to mention when it is asked. Then coming to the nerve supply of bladder, it will be more clearly discussed in physiology. That's enough. If you write that in here also, it's okay. There is a diagram given here, the innervation of bladder. You just focus on this diagram and the day before exam. Then a short note, prepare a short note on neurogenic bladder, what are the different types of neurogenic bladder. Then urachus, this is again an embryology topic, the congenital anomalies of the urachus, you just be thorough. Then coming to the male urethra, you just know the important parts of the male urethra, and there is a beautiful diagram here depicting the different parts of male urethra. Then again a tabular column is given, the prostatic, membranous and the spongy part, and how each differs, what are the differences between the 3 parts. Again a tabular column, that's enough, you just focus on that tabular column. But you have to read about the rupture of urethra, because it can come as a structured essay. Then about the sphincters of urethra, urethral sphincters can be asked. You just focus on the tabular column, the differences between internal and external urethral sphincter, that's enough. Coming to the male genital organs, the prostate gland can be asked as a short note. When you study prostate gland, the lobes of prostate gland very important, the capsule of the prostate gland. Then the surgical correlation is like the prostatic venous plexus when you do surgery, that concept you should be clear. Then the structural zones of the prostate gland. You know the outer zone, the inner zone, the innermost zone, and the new concept like the central zone, transitional peripheral zone, those 2 concepts you should be knowing. Then the clinical correlates like the benign prostatic hypertrophy and the prostatic carcinoma. That also you have to know, because it can again come as a essay. Then coming to the vas deferens, what do you mean by vasectomy? It's ideal to know that. Coming to the female genital organs, coming to the ovary, you should be knowing about the arterial supply of ovary. And of course, the structure of ovary you will be studying in detail when you study histology. Then coming to the, yes, of course, you should be knowing about the development of ovary. Then coming to the fallopian tube, what are the different parts of the fallopian tube? And just have a clinical correlate questions like salpingitis and what do you mean by tubectomy. Then coming to the uterus, you should be knowing what are the different parts of uterus, the axis of uterus, those two are asked. Then the relations of uterus, you can just have one single diagram. If you just focus on one single diagram, then it will be easy for you to understand the relation. Then coming to the ligaments of uterus, you know that there are two sets, false ligaments and true ligaments. First study the names, then in detail about broad ligament. That's very important. Then the arterial supply, there are two beautiful diagrams. You just focus on those diagrams, then it will be easy for you. And the lymphatic drainage, just one diagram. You just focus on that diagram because for structured essay, you might get questions. Then supports of uterus alone can be asked as a short note, the primary support and secondary support with the help of two diagrams. Then fibroid, read about fibroid of uterus. Then coming to the next topic, rectum and anal canal. Rectum, the peritoneal relations of rectum. The anterior and posterior relations, there are two tabular columns. You just focus on those two tabular columns. Then you should be knowing about the valves, the Houston's valves, the permanent folds can be asked as a short note. Then arterial supply, venous drainage of both rectum and anal canal, very, very important. Then fascia of Valder, you should be knowing. Then coming to the anal canal, the interior of anal canal, how you divide it, the difference between the upper and lower anal canals, there is a tabular column given, you just focus on that tabular column. Then the anal sphincters, you should be knowing what is the difference between internal and external anal sphincter. Then the arterial supply and venous drainage, just like the rectum, you should be knowing. Then hemorrhoids, very favorite question, you should be knowing what do you mean by internal and external hemorrhoids. So these are the very important topics from an abdomen and pelvis, but definitely you have to read the entire topic 2 or 3 times before you focus on the important questions. Thank you. Thanks for watching.